It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your usual and regular anchor on this program. Today we'll be discussing you are as old as your eye. You are as old as your eye. And with me in the studio is no other person than our very delectable, pretty, intelligent Professor Adeola Onakoya. She is a consultant ophthalmologist, and of course, she used to be the head of departments at the Lagos University Teaching Hospital. She is a guru when it has to do with the eyes. I can't justify her CV is so long. If you are regular on that program, I'm sure you must have known her. So many people have been demanding and asking, Doctor, please bring Professor Onakoya. Doctor, please. Now she's here with us in the studio. She is going to be telling us about you are as old as your eye. And she currently works at the Lagos University Teaching Hospital. Prof, you're welcome to the program.
Thank you for having me.
As usual, you're still looking very young, pretty.
Thank you.
Well, you're as old as your eye. So let's roll with this. Let's just roll with it. When you say you're as old as your eye, what exactly are you talking about? Yes. Has age got to do with it? The children, the adult, the middle age?
Yes. Just as I've said, you are just as old as your eyes. Okay. You know, as we get older, we notice some changes in our body, in the systems generally, the organs in the body. Regardless of how long you live, you know, the body, you know, the time will take its toll on the organs that we have, all the organs of the body. A lot of us were quick to notice on our skin. You notice that your skin now, you lose fat and then you have loose skin. Just as that is going on, then you notice gray hair on the head, you know. As that also is going on, there are a lot of changes that are going on in the eyes. Okay. In fact, sometimes it's easy to know, to guess somebody's age, you know, when they come to the clinic complaining. For instance, somebody walks in and says, oh, doctor, I just noticed that I found it very difficult to read tiny prints. Then I know that this person is about 40 years or even older than 40 years. You know, so as we go along, you know, we'll get to how that happens. But as we are getting older, as the hair is going gray, a lot of changes are taking place inside the eye. And that also, you know, tends to affect, you know, how we function. You know, whether you want to read, you need more light, you know, there are so many things that are attached to it. And, you know, it's important for us to know so that when such happens, then you know where to go and what to do.
Because when they say when the people begin to discuss bones, the older people begins to shake. Okay?
Yeah.
Okay, so let's see, has any disease condition got to do with it?
Well, for people who suffer from some systemic conditions like hypertension, diabetes, if you have high level of cholesterol, you know, which we call hyperlipidemia, all that may promote it, you know, the patient may develop it at a much earlier age, or one may develop these changes earlier than one peers. For instance, if one has diabetes, cataract, you know, which comes also with age, will come up earlier. If one has hypertension, you know, if you have diabetes, or if your lipid level, cholesterol level is very high, you know, in the past we've talked about age-related macular degeneration. All this will come up at a much earlier age. You know, the peers may have it about 65, 70 years and above, but this individual with this medical condition may develop it at about the age of 50, you know, 55, they discover that they have those conditions. So those are like predisposing factors at that age. However, you know, there are some that you don't even need to have a pre-existing medical condition. Even cataract, you know, if you live long enough, you will develop your own share of cataract. You know, that is the lens that is inside the eye becoming cloudy. It's not as clear as it ought to. So when rays of light enter the eye, they are scattered in different directions. So they don't form a point focus that would allow you to see clearly.
Okay.
So, but you know, as we are getting older, because the lens in the eye is becoming thicker and thicker, because every day new fibers are added to the lens inside the eye. And you can imagine if that is going to happen, if one lives to 70 or 80, over 80 years, these lens fibers are, it gets to a stage that it becomes very hard, and then it's not clear, it loses its transparency, because the natural lens is transparent for us to be able to see. And the moment it loses that transparency, then that individual has developed lens opacity, and when it begins to affect vision, then it is cataract. So if you live long enough, you will develop your own share of cataract. And other conditions in the environment also promote it, even the ultraviolet rays. So if you go out into the sun, is there anybody who lives without going out into the sun? The lens, you know, absorbs the ultraviolet rays, and it damages some of the things inside the lens. And, you know, you can imagine over time, as you get exposed to the sun, you know, the lens continues to change, and what is there is development of cataract. There may also be some things, other things in the environment, like what we eat, and also seasons, you know, periods that the individuals are not well hydrated. All this can promote the development of cataract. So that's why I keep telling anybody that comes, my patient, I say, look, cataract is not a disease. As far as I'm concerned, it's an aging process. If you live long enough, you will develop your own cataract. And the good thing about it is, yes, it reduces your vision, but it is, in fact, it's the commonest cause of loss of vision all over the world, anywhere in the world. And the good thing about it is the loss of vision is reversible. All you need is go and see your ophthalmologist, who will arrange for you to have an operation. That cloudy lens will be washed out, and then it will be replaced with an artificial lens, and your vision will just be as good as you started. For a child that is very young, a baby, if that child has myopia, that is short-sightedness, for instance, it means maybe the baby's eye is big, you know, such a child, you know, you see, if he wants to look at everything, pulls it very close and then just looking closely. Or sometimes some of them actually have congenital glaucoma, or they have some other eye conditions that we need to see. But if a child has myopia at a such early stage, then something has to be done, you know, because if nothing is done and the child is growing with that eye, you know, the myopia may actually progress.
What is the
especially
myopia? That
is things that are very close are just the things the child can see. Anything that is far away, that child is not able to see, you know. So, but the other problem we have now with children, you know, as they are growing, I said they get to a stage that is called emmetropia. That is, everything is normal, whether far or near they see. The eye is just normal size. But now that we have exposures at the very early stage to all the digital devices, you know, you have the phone, you have the iPads, you have the tablets. For these children, a child that is mildly myopic at a very young age, let's say before 1 year, and you keep giving this child all these devices, all that the child is doing is to be working at that close range and putting a lot of strain on the eyes. So the eyes then tend to get bigger and bigger, and the myopia increases. So by the time that child is about 10 or 12, the child would have what we call a high myopia, and you also have to check that, you know, take them to the ophthalmologist or optometrist. They give them prescription and ensure they wear the glasses and ensure that they stay away from all these digital devices. Control the timing, not that they stay on it for 18 hours or 16 hours. Yeah, you see a year-old and the mother, once they get there, they just give the child the phone. And you see the child just keep staring. You know, it's not good for their eyes at all. So that is what it is. And then, so we've talked about myopia and then the hypermetropia. However, some children, when they develop it, they never outgrow it, so they continue with it. Because sometimes for some of them, by the time they are at the age of 18, 20, you know, the eyeball stops growing, and then they get to the phase of emmetropia, and they are fine. Now, take it from there. As we are now getting older, you know, I said the lens keep adding every day. And the ability of the eye to see well, for you to see things that are far and things that are near, the lens has to change its depth of focusing. For me to see things that are nearer, the lens would, some muscles inside the eye need to contract.
Is there a way we can use demo?
Yes, I can demonstrate with this. So when those muscles, this is the, yeah. So this is like a cross section of the eye. This represents the lens inside the eye. So this is the lens here. And this lens is held in place by some fibers which is attached to some muscles here. So for us to see things that are close, these muscles here, of course, they have to contract. When they contract, the lens then changes its shape and the eye becomes stronger. Then I'm able to see things
Properly.
that are close. Because normally if you sit down, you can only see things that are far. For you to look at things that are close, you have to make like an effort.
A conscious effort.
Yes, you have to make a conscious effort, and that is what happens. So, but as we are getting older, the ability of the lens to change its shape for you to see things that are close to you, reduces because the muscles are getting weaker. Our skin is getting, there's laxity of the skin, muscle is getting weaker, some things are degenerating, some enzymes that are necessary are not there, they are getting depleted. So the ability of the muscle to contract also reduces. And the lens also is not able to change its shape to be, more convex. You need to be more convex for you to see things that are close. So you then begin to see that as we are getting older, getting to about the age of 35, 37, for you to look at the fonts, those tiny fonts on your phone, you have to do like this.
Yes,
Or if you want to read at night, you have to increase the lightning.
Lights.
If you have to read in the morning early, you increase the lightning. By that time, the lens is not able to change its shape, because of the weakness in the contractility of the muscles and also the hardening of the lens. And that condition is what we call presbyopia. And you then notice that when you go to see the doctor, some people don't even go to see the doctor because they know that if I go to people that are selling glasses, by the roadside, they just get there, put it in the eye. Yes, I can read now. And then they just leave. That's not a good habit. What you should do is go and see an ophthalmologist or an optometrist who will examine your eye and be sure that that is the only condition in the eye. But that condition is called presbyopia. And what I tell people is, as you have gray hair, so also is your lens going gray, is getting weaker, and you are not able to read. So it's not a disease.
Prof, just hold it there because we'll continue. It's getting very, very, very interesting.
Yeah.
But as you get older, it is not the same as when it started.
Yeah.
Wow, my viewers out there, I'm sure you're actually enjoying all that Professor Onakoya is dishing out at this moment. But we need to keep up with the physicians out there. Let's hear what you have to say. Are you as old as your eye? Let's hear from you. We'll be back after this short break. Stay tuned.
Getting dim and you're having pains, the first advice you should do is visit an eye doctor. In taking care of your eyes, I advise you to take any fruit that has to do with vitamin A, carrot inclusive, and then you regularly check your eyes. So that's the number one. So you know the stage of what you have gotten and how to take care of it. Basically, get advice from your doctor.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We have been discussing you are as old as your eye. And in the studio, we have Professor Adeola Onakoya. She is a consultant ophthalmologist at the Lagos University Teaching Hospital. She's actually been schooling us from birth cradle up until where we got to the stage where the people begin to go to just the quacks to go and take eyeglasses, which she has said is wrong. But let's hear from her. She will tell us the right way to attaining good eyesight. Prof, let's continue. You've told us a whole lot, and you've used actually a model.
So we stopped at presbyopia.
Yeah.
That is when the ability of your eye to change the shape of the lens, to change the shape for you, to change your focusing from far to near so that you can see well. And just like I said, as you are getting older, it becomes increasingly difficult. And the only way is to relieve it by giving you convex lenses. You know, I said the lens becomes convex, it curves.
Yeah.
So all you just need is to augment.
To make it
Yes.
pop up.
So you just increase the power, you know, of the eye by aiding it with that convex lenses. And that is why you hear people saying, oh, I wear +1. I wear, because convex lenses are plus lenses. You know, concave lenses that people who are short-sighted, the myopics, wear is minus. You know, so convex, they tell you, oh, my power is +150, just give me. My power is +2 or +3. You know, so that those are convex lenses.
So before, so I don't skip it. Are those people that are actually negative, is there a time that they become positive?
Yes. Now, those that are negative, it's an advantage to them up to a point. Because by the time they are 40, they won't have the problem of reading because they are comfortable naturally. They are comfortable with near tasks. But by the time they are getting to 60, then they begin to see some even 50. They tell you that, oh, okay, I think I need some help here. You know, so for those ones, it may go for a longer period of time before they become presbyopic. Now, I just want to quickly touch on the fact that when some people come and you tell them that, oh, you need to wear glasses, the first response is, oh, my father is 80-year-old, he's 90, he's not wearing glasses. I mean, he wore glasses before, and now he's not wearing. Now, the reason is very simple. As we are getting older, you know, I explained about the lens. Yeah. Now, that lens, as it's becoming harder, it gets to a stage that it now renders you short-sighted. So somebody who was wearing plus lenses to read from about the age of 40, by the time he gets to 65, 70, he notices that even without glasses, not seeing well, but if I take off my glasses, I'm able to see, because the eye is now myopic to some extent because of those changes in the lens. And that is what is referred to as second vision. So people throw away their glasses at that stage. So the young man you are talking to doesn't know that that is what has happened. So I keep saying, you know, we all have our own fair share of presbyopia, of development of cataract, you know, because these are normal aging changes. Now, but before I go on or go back to the inside of the eye, on the surface, these are conditions that a lot of people suffer from. If I start from the eyelids, you know, this concerns the ladies a lot. We are bothered by it. You just notice that you have a lot of redundant skin of the eyelid, particularly the upper lid. You see, yes, it's saggy, or you have a lot of wrinkles there, you know. That is what is called dermatochalasis. It's because we are losing fat, you know, the fat underneath the eyelid. And for some people, it may even happen on the lower lid, and then they have what is described as baggy eyelids. Well, on its own, what you can do is to go for surgery if you don't like it, or sometimes, you know, fillers are injected. That's cosmetic? Yeah, it's cosmetic. Or fillers are injected into it, you know, so that it makes it to bulge out, fuller, and then, you know, you are happier. However, one thing about it also is because it's on the lid, you know, and that is where you have one of the components of tear that helps in lubricating our eyes from the lid. Then it means that the liquid layer is exposed. So if you sit outside where there is, from the environment, there is fan or air conditioning, or there's a lot of heat or high humidity, you know, what happens is the tear dries quickly. So the eyes get dry. And then you see that the eyes may either be red, it becomes gritty, you know, or you have this sandy feeling, or as if you have some foreign substances in your eye, or you discover that you keep rubbing the eyes. Or sometimes when you read for so long, you know, the eyes get tired because the eyes are dry. You know, these are all signs of dry eyes. But apart from the effect on the eyelid, the other one also is, you see that mucoid layer, the basal layer, you know, as we are getting older, you know, just as other things get depleted, that layer, the goblet cells that produce it also get depleted. So you don't have enough, you're not producing enough. And that is the type that anchors the tear. That is the part that anchors the tear on the surface of the eye. So if that is missing, then the liquid part cannot stay on the eye. And then even the oily part cannot stay. So that is a type of dry eye whereby you see that the eye may be watering, okay? It may be watering, because of that loss of the goblet cells. And of course, the eye gets dry because it's not staying on the eyeball. So those are the reasons why we develop dryness of the eye. And it comes on earlier in women, than men because,
Any
of course,
reason?
hormonal,
Okay.
hormonal. Estrogen production has gone down, and that aids some of the production of those substances in the eye, that aids the lubrication of tear in the eye. So dry eyes is part of the problem. What do we do? If you have dry eyes, well, see your doctor. You'll be advised as to what to do. But before you see doctor, just make sure you don't expose your eyes. Air conditioner, don't sit very close to it. And then if you're reading, when you open your eyes, particularly now, we are going back to digital devices.
Yes, no.
You stay on the laptop for like 3 or 4 hours with your eyes open. Because ideally, you should blink like 15 times. You should have 15 blinks in a minute. But people don't blink because you are just
15 blinks in
a
minute.
minute. Yes.
Beautiful.
But you because you are staring. When you are staring, a lot of wind blowing through, so the eyes also get dry. And by evening, the eyes are very tired. And sometimes you notice that your eyes are just red. You may not even be aware because it may not be painful. People will just tell you, why are your eyes so red? Because you've just been staring. You haven't lubricated the eye. You've not allowed the natural phenomenon of blinking to lubricate the eye because you forced open your eye. And that's why we advise, the 20-20-20 rule. That is, after reading for 20 minutes, close your eyes for stare at distance that's 20 feet, like 6 meters, for 20 seconds. No, 20. Take off your eyes for 20 seconds, look forward, close your eyes, and blink within that time. That way you can prevent the complications that may come from dry eyes.
Wow.
And then there are other things, of course, you need to visit the ophthalmologist and you'll be told what to do. Or you may have to be lubricating your eye using a lot of tear substitute. But it's also good to see the ophthalmologist so that you are assured that that is the only thing, because there may be other conditions that may also cause dryness, particularly in women. It's important that as we are getting older, we should get our eyes examined, checked, because there are diseases that come up with aging. Apart from cataract, is the glaucoma. This is a degenerative disease that also affects the nerve in the eye. And we know that the optic nerve, which is the nerve that enables us to see, is actually the connection of us with the environment. The ability to interpret or to perceive what's in the environment is a function of the optic nerve. But the optic nerve, just as other parts of the body are degenerating, it is also degenerating. However, on top of the degeneration, some people have a predisposition to this glaucoma, which is a degenerative disease of the nerve. And in them, the rate of degeneration is far, 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 far more than in people who do not have glaucoma. So that's why it's important, as we are getting older, ensure that you see the ophthalmologist or the optometrist like once in 2 years if you don't have a family history of any eye disease or blindness. But if you do, then I will say once a year. It is also important if we have other medical conditions like hypertension, diabetes, you need to see your doctor, particularly those who have diabetes. You must get your eyes examined once a year. And if your doctor is happy with you, he would ask you, okay, I'll see you in a year. But if doctor sees anything that is alarming, maybe some spots or hemorrhages, he probably will give you a 6-month appointment. Or sometimes you may even need to have it treated, either with laser or you'll be given an injection in the eye. So it's important for you to stay close to your doctor.
Time is not always enough when we have you here, Prof.
Thank you.
To school us on things that have to do with the eyes. Yes. Indeed, we all agree now that actually you are as old as your eye. Yeah. And you have to actually take very good care of your eye. So I want to just say thank you again for coming on our program. And I'm sure we won't stop calling on you. because we always want to see you again and again and again. Really
It's a
appreciate
pleasure.
you. And for our viewers out there, I want to say thank you for keeping a date with us again today. And you heard all that the prof has said. You are as old as your eye. Remember to do those regular exercises, the blinking, if nothing else, at least
Yes.
15 times, right? 15 times, ensure you blink. But when you are asked, why are you blinking? Just say that is how it's supposed to be. Because I'm not sure you're actually aware that you should blink at least 15 times.
Yeah.
It's not conditioned,
No, it's
right?
just quick, 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 quick.
It's reflex, you know. So just try and do that. You look left, right, up, and down. You just do some little exercises. That if you are always on your computer, on your system, try as much as possible to reduce the number of hours that you expose your
Yes,
eyes
and take
to rise.
breaks.
Take some rest. Just go away from that place. Then for mothers that want to just pacify their children, and you give the tablet, you give the phones, they are doing more of the service to these children. So I want to just say thank you again for being part of us today. Till next time, ensure that you always follow us on our social media platforms, on Instagram, on Facebook, on YouTube. And if you want to be part of this program, our website is up and running. Just go there, complete the form, and you'll be our guest. My name is Dr. Martina Agbere. Stay blessed. Till next week.